Health Services for Children with Special Needs is an innovative care management organization providing personalized coordination of healthcare, social, education, and outreach programs to improve the health status and quality of life for children and youth with special needs. One such family support program is the Male Caregivers Advocacy Support Group, a community-based peer-to-peer program designed to provide peer support and mentoring to male caregivers of children with disabilities and chronic illnesses.
Hello, my name is Uzoma Opaibog, and I'm a proud member of the HSCSN Male Caregivers Advocacy Support Group. Our organization is unique in that it provides a forum for males to come together and dialogue, gain specific aspects of education relating to their child's diagnosis, and also to give them critical information that they need so that as they are healthy, they can take care of their special needs children. A key feature of the HSCSN Male Caregivers Advocacy Support Group is that we help parents to accept their child's diagnosis. I have a daughter who has a special need. So I know how it is when a parent first learns of his or her child's diagnosis. But with the right education and the encouragement that comes within a group like the Male Caregivers Advocacy Support Group, a parent like myself can be empowered and enlightened on how to take care of my child. Also, we have as an essential component of the Male Caregivers Advocacy Support Group what we call checking time. This means that every week, all the members share how our past week went. And as we begin to share about our experiences, the concerns and challenges that arose during that past week, it provides an opportunity for us to encourage ourselves, to share what our strengths are, and to help each other with respect to our weaknesses. And the more we as male caregivers are healthy, we can in turn help our children. We meet every Wednesday from 6 p.m. to 9 p.m. Come and join us, and you'll be glad that you did.
I've been a member of the Male Caregivers Group from Health Services for Children with Special Needs for a little over 6 years now. I was actually invited to the Male Caregiver Support Group by a friend of mine. I was invited several times before I actually came to the meeting. I was told that the Male Caregiver Support Group offered information for fathers with children with special needs. Of course, I've been invited to so many other groups that offer support, but none of them never really offered the support or resource information that I needed. But once I finally came to HSCSN in the Male Caregivers Group, I actually did start to find that there were support efforts in place that could help not only fathers, but fathers with children with special needs. I have 5 children. One of my daughters actually is a child with special needs. It was actually in a car accident several years ago, who is still in recovery from that accident. I learned that her recovery process didn't only involve her, but it involved me as well. From the very first day of that accident, I found that I had to get on a path of recovery as well with her. Through the help and support of the male caregivers from Health Services for Children with Special Needs, I found so many resources and information that was very valuable to me, not only with helping me with my children, with my daughter with special needs, but all my children. I learned that I had to get on that same path of recovery with her and learn how to cope and deal with not just the daily things in life that troubles us and support efforts, but it helped me with communication issues with all my kids. And now I've been able to take those resource information and help others, not only my family, but I've also witnessed through Health Services for Children with Special Needs, other fathers getting more involved with their children and getting more resources to help them in so many other facets and elements in life. Of course, it's always tough being a father or a parent, but when you have a child with a special need, it takes on a different element in life, and you need additional resource information, and sometimes the resources isn't just enough. A parent with a child with special needs have to first understand that that parent need additional services even before the resources can take place. Those parents deal with issues with self-esteem, why are they in this situation with their kids. Some of the parents even think that is their fault. But again, I'm an advocate for my children. I'm an advocate for any male with children with special needs in helping them with their daily walk on this recovery path. There's so many things that we can recover from in life. Everybody is recovering from something, but there's so many other things in life that fathers are faced with that can lead us into a downfall. But I'm here to let you know that those things can lead you into a downfall, but don't have to. We have to put the same effort and energy into our recovery efforts that we did in those downfall elements to recover from them.
I learned about the male care group through a radio interview. Hearing about their great accomplishments, I stated that I want to be a part of such a vital organization. I realized I want to be a good father and I wanted to improve, but we want to be better fathers. As a good father, we're operating in the positive degree. As a better father, we're operating in the comparative degree. And as the best father, we're operating in the superlative degree. We realize that learning is ongoing. From that perspective, we said learn as though you're going to live forever. Live as though you're going to die tomorrow. Exemplifying those qualities, we impress upon our children that the fear of God is the beginning of wisdom, emphasizing that with that, we can accomplish anything. If I can impart those qualities into my children, and being a part of male caregivers, our ongoing educational institution, I, the counselor, will be improving.
Max is the most important thing in my life right now. I'm the proud parent of 2 children with special needs, my nephew and my son. Through Max, I learned a lot about parenting skills, about resources, and about how to get things done. And also, the main important thing, I am an advocate for my children. A couple of years ago, I ran into a problem. My nephew, who was in an aftercare program, all of a sudden we got this notice one day that he was no longer in the program. And he had been in the program for over 6 years. So they said his name was dropped from the list, and we had to find alternative resources for him to be in the afternoon. So my wife, each afternoon, she would go there to pick him up and bring him back to her job, or I would go and pick him up and bring him back to my job. So this went on for a couple of weeks, and all of a sudden the manager says, this has to stop. Either you find alternative means for him or find another job. And rather than panicking, I contacted Max. And Max, through their resource and everything, we found an alternative school for him, a school that was even better. And as a result, my nephew was happy, I was happy, and my wife was happy. She didn't end up losing her job. But not only through Max, I've also learned a lot of other things about how to improve your parenting skills. Not only parenting skills, but things about schools, finding the right school for your child. And also there's the Youth Athletic Program, which is called YAP, which is for kids who have special needs, who do not have special needs. It's where we combine them both. We have soccer, we have t-ball, we have basketball, and we also have golf. And sometimes it's the first time some of these kids have ever held a golf club in their hand. But the main thing about the YAP program is everybody gets a chance to participate. You should see the joy in a kid's eye when he hits the ball for the first time. And you run it down to the first base. He's so happy. So he doesn't know whether he has a disability or anything of that nature. He's just happy to participate. And that's what the YAP program does. It gives kids an opportunity to participate. Not only that, but I am an advocate for my children. Because if I don't advocate for them, no one else will. And through Max, I've done a lot of other things, such as testifying before City Council. I had never done that before. But I was given the opportunity, I knew what to do, and that was I call it my 10 seconds of fame. So as I keep saying, my children are my future. I am an advocate for them. They can't speak for themselves, but as a parent, I can speak for them.
For additional information, contact Cecil Doggett, Director, Department of Family and Community Development, at 202-835-2771 or call the Male Caregivers Advocacy Support Group at 202-721-7172.